Alarming new data showing significant increases in children diagnosed with mental health conditions.
A new study from the U.S. Department of Health and Human Services says anxiety and depression grew by nearly 30% for children ages 3 to 17. That's from 2016 to 2020.
And getting help is not always easy with a shortage of mental health providers. But as senior reporter Eileen Buckley shows us, a specialized new clinic just opened in Kenmore.
We want to be able to provide a service at a much faster rate for these families that are clearly in dire need of services.
This is what the Family Success Center looks like on Kenmore Avenue near Elmwood in Kenmore. Envision Wellness opened this clinic to meet a growing need to serve children ages 5 to 18 and their families. Brittany Aponte is a counselor. She says some families are on a 6 to 8 month waiting list for mental health care for children.
Anybody that's struggling with anything emotional, behavioral, is something that we can help out with.
You might say that this new clinic is offering a little corner of hope for families who are trying to deal with their child's mental health issues.
If you have an inkling that mental health counseling might be a help and a support for your family, come on in.
Michael Nementi, Director of Clinical Services for Envision Wellness, says there are not many mental health agencies in the Kenmore corridor, and his agency is responding to a crisis-level need for help. Experts say only half the children with mental health conditions sought help this year.
We're always open to talking to parents. We're doing a lot of outreach right now, working with schools. We're going into schools and talking with their staff to make sure that they know about us. We just had a conversation with the crisis intervention team with Buffalo Police so that they know that we're here.
The U.S. Department of Health and Human Services study was conducted between 2016 and 2020, finding for kids 3 to 17, their anxiety grew by 29% and depression by 27%. If you're a parent, I asked, what are the warning signs of anxiety and depression in children?
They might have, a temper tantrum or be explosive in a classroom, and those adults or other students might say, man, that kid is mean, or that kid doesn't know what they're doing, but really they're anxious, or really they're sad. Every behavior has a reason, and so if we can figure out that reason, then we can help that child, that family, that classroom to be a better fit place for everybody.
Right now, the clinic is able to serve individuals and families, but will be adding groups and expanding to adults. Eileen Buckley, 7 News, Kenmore.